friends, welcome back to the channel. Today we're going to be talking about how to reverse facial hair in women, and I'm going to be talking specifically about abnormal facial hair in women. So this is hirsutism, or facial hair due to polycystic ovarian syndrome, or PCOS. So a lot of times women come into the office because they want to get laser hair removal for removal of this abnormal facial hair. And it's before we ever go ahead and try to do laser hair removal, I always want my patients to have an understanding of why they have this facial hair in the first place, and to understand my methodology of how I go about reversing facial hair in these women. Okay, so the first thing that I always explain to my patients is that facial hair is normal in most women, and normal facial hair is usually going to be thin. So normal facial hair does not cause hyperpigmentation, it doesn't cause ingrown hairs, it doesn't cause scarring. It's just normal and it's thin, and we call it vellus hair. If the hair is now thick, then the reason that is happening is because there's an abnormality in your hormones, okay? And so usually this is what hirsutism is. Hirsutism is when women are growing hair in a male pattern. So male pattern hair growth. This is going to be thick hair on the face, chin, jawline, neck, sometimes cheeks. It's also going to be hair on the chest. It's going to be hair on the back, upper arms, upper legs, sometimes on the belly area, and even sometimes on the areola as well. And so that is what we call hirsutism, which is abnormal or male pattern hair growth in a woman, okay? And so then once we know that you have this abnormal hair, the question is, why is that hair becoming thick? And if you go back and look at why men have thick hair, it's usually because of androgens such as testosterone. So then we're going to need to figure out, do you have abnormally high testosterone levels in your blood, right? And so if you do, then we will usually do blood work to check and see what's going on. But before we even do blood work to check for testosterone, we will also do blood work to figure out what else could be going on, because the first thing that people see is the facial hair, right? And then you ask yourself, why is the facial hair occurring? Then you go back one step and you look at androgens or testosterone. But you also then have to ask yourself, why are the androgens high, or why is your testosterone high? And so there's usually two main areas where you could be having abnormal testosterone. The first is going to be in the ovaries, and so this is in the situation of polycystic ovarian syndrome, where your ovaries are producing high amounts of testosterone, and the downstream effect for a lot of people is excess hair, acne, and sometimes infertility as well, in addition to weight gain, okay? And if it's not coming from your ovaries, then it could be coming from your adrenal glands. And again, similar, your adrenal glands can make all the hormones that your ovaries can make. And so then you have to then look at what are your levels of androgens that are coming from the periphery or coming from your adrenal glands. So we will check for that as well. And then you have to then go back to another downstream level, which I truly think is the core reason why all of these issues occur. And the core issue is usually going to be insulin resistance. So in women with PCOS, or in women with hirsutism who don't have PCOS, the core problem for them is going to be insulin resistance. So when someone comes in for facial hair evaluation or facial hair removal, the first thing that we're going to be doing is we're going to be doing blood work to check for insulin resistance, because that is the core problem. And then we might also do blood work to see if they have PCOS or if they have abnormally high androgen levels. And if they do, then we have to figure out where the androgens are coming from. Is it coming from your adrenal glands, or is it coming from your ovaries? All right. And so first thing that happens when you come in is we do your basic blood work, which is going to be your complete CBC. We do a CMP just to see your liver function. We check your blood glucose. We check your hemoglobin A1C. We check your fasting insulin because that's also going to help us determine if you're insulin resistant. And we also check your lipid panel, amongst other different tests that we check, just to make sure that we can confirm that you are insulin resistant. And so once we confirm that you're insulin resistant, then the next thing that we do in the practice is that we're going to put you through our shed resistant fat program. And so this is a 12-week program where we teach you how to reverse insulin resistance using nutrition, lifestyle changes, and exercise. And so once you go through this process for 12 weeks, and we're doing this in addition to doing laser hair removal treatments, once you do that process, we will then check your blood work again, usually every 3 to 6 months, to see if the numbers are going in the right direction. If we find that the numbers are going in the right direction and the laser hair removal treatments that we're doing are also doing well, then we keep you on that protocol. But if we're doing laser hair removal and we're hitting a roadblock, because again, if the hormone is not controlled, the hair removal is not going to work, then we might then add medications such as GLP-1 medications to help hasten the process of reversing insulin resistance so you can get the results that you want. So the 3-step process that we do is 1, we're going to determine if you're insulin resistant. We're going to do blood work, both checking for insulin resistance, and sometimes we will also check to see if you actually have PCOS. And then we're going to put you through our shed resistant fat program to help you reverse insulin resistance without medication. And if you fail the program or if you need extra help, then we might add medications to help the process along while we're also doing laser hair removal treatments in the office. So this is our approach of how we help reverse facial hair in women. If you're in the DC metro area and you're looking for a practice that can help you reverse facial hair or abnormal hair, PCOS hair, hirsutism, then I will link our practice information below. And if you're a woman who is looking to reverse insulin resistance or to lose weight, then I will link our shed resistant fat program, which is a group coaching program that I run, where you can purchase that and join the program to learn all the things that the doctor is not going to teach you in the office to help you reverse insulin resistance from home, so you don't have the downstream effects of facial hair, acne, and all the other things that can come with it, right? Diabetes, high blood pressure, all of that. So I hope that you found this video helpful. If you want me to go in depth and do more detailed videos about different components of PCOS or insulin resistance, leave your comments below. And if you're interested again in working with me, then I will leave all my information below.